It has become appallingly obvious that our technology has exceeded our humanity. I am Lucas Ortiz.
I'm Braden Jacobson.
I'm Matthew Hansen.
I'm Isabella Leo.
And I'm Titus Zapata. This quote that Lucas just referred to reassures the importance of technology today. Technology has given numerous opportunities in the past and continues to do so today in healthcare through vaccines, disabilities, VR, and telemedicine. This brings us to our question. To what extent has technology played a role in healthcare industries in the U.S. within the last 10 years? Technology continues to have a positive impact on healthcare, affecting many patients around the country. Here are some of the things that health industries can do to continue this. Health industries can continue to implement new technologies into their program, increase the accessibility of their services, and focus on the completion rate of scheduled visits.
Technology, as we know today, has a significant and major impact in vaccines in areas like nanotechnology, COVID-19, and plans for the future. Nanotechnology is a technology inserted in vaccines. They are the fatty molecular envelopes that help strengthen the mRNA molecule. In this image from Frontiers, in the left we can see the mRNA molecule as normal. In the right we can see the mRNA molecule with a capsule created by nanotechnology to help the mRNA molecule to send its message to the body. In this graph from National Bureau of Economic Research from October 1st to December 1st, we can see a rapid daily deaths caused by COVID-19 increase. But a couple weeks after vaccines were inserted, it's noticeable a decrease on daily deaths caused by COVID-19 because of the vaccines. According to Dr. Oslam, Chief Medical Officer of BioNTech, both the COVID-19 vaccines and the new experimental cancer vaccines are based on the same technology, being nanotechnology. Also, according to Dr. Brodowski, recent medical advances in the COVID-19 vaccines are same to technology urged by medical needs globally.
Technology has been assisting those in need in the healthcare industry by helping people who lack the ability to perform certain tasks. One of these ways technology has been helping disabled people is because of the rapid development of 3D printing. According to pediatric cardiology, 3D echocardiography provides highly accurate 3D printed models in congenital heart disease. Cardiac 3D printing is mainly performed from MRI and 3D computed tomography datasets, although an anatomic detail of atrioventricular valves, or AV valves, may be limited. 3D echo provides excellent visualization of AV valves. Outside of this, scientists and doctors understand intellectual and developmental disabilities more than ever, leading to them taking early action to prevent these disabilities from getting worse. A study was done to see the effectiveness of technology-aided programs, and the study concluded that technology-aided programs can be adapted to people with acquired neurological damage and multiple disabilities to support their independent occupations and communication engagements. Moving on, multiple big name companies are doing their part by creating assistive technology. Sony in late 2022 announced Project Leonardo, which is a controller kit to help people with disabilities play PS5. Before this, in 2018, Microsoft launched the Xbox Adaptive Controller, which is a controller made accessible for people with disabilities. As you can see in the image, the Xbox Adaptive Controller has two large programmable buttons and external button jacks for all external buttons. These features give the same access to a regular controller as allowing anyone to play their favorite game no matter the circumstances. Much like this, another type of assistive technology is virtual reality.
Like Matthew stated, technology in the medical field has had a very positive impact on patients, with one being virtual reality. Virtual reality is a drug-free alternative that provides a high degree of overall patient well-being and progress towards better healthcare. Virtual reality has assisted doctors' performance in diverting the patient's attention to help lower the level of extreme discomfort. Shown in this image on the left is a patient undergoing hand surgery while using virtual reality. In the image on the right is what the patient is seeing through the VR lens. These two images signify virtual reality as an effective tool in diminishing pain or anxiousness in which a patient may be experiencing. In the same study conducted by Adil Faruqi, doctors monitored anesthesia care for hand surgery. Two groups were compared, one being the control group, those without the VR headset, and the virtual reality group, those with the VR headset. Doctors found and recorded that those in the virtual reality group required a lower amount of sedation than those in the control group, which can be represented in this graph. Not only has virtual reality impacted those undergoing surgical procedures, but it also can be found beneficial for women in labor. Erin Martucci, a mother of 3, birthed her 2 youngest children using virtual reality. Throughout Martucci's labor and contractions, virtual reality provided her visuals of a scenic beach setting with the blue ocean to calm her down. Shown in this image here is Erin Martucci with a healthy and happy daughter, Elizabeth.
Telemedicine is the distribution of traditional healthcare services via electronic communication and is starting to overtake the traditional healthcare services. According to this chart, there is an over 3,000% increase in the use of telemedicine during the pandemic that lasted from 2020 to 2021. Digital therapeutics are like telemedicine, except they help with more mental health rather than physical health. Digital therapeutics will help give advice on how to deal with mental problems and disorders and advice on how to treat them. According to this chart, digital therapeutics will continue to grow over the next decade at a staggering amount and may begin to overtake the use of regular therapy.
To conclude, technology has proved to bring a significant impact on healthcare. The question now is, how will technology impact healthcare in the future and how it affect its consumers? Well, with a survey done by the Healthcare Financial Management Association listed on the board, stating that 83% of patients were more likely to use telemedicine after the pandemic. Technology works on increasing the efficiency of healthcare, while telemedicine works on eliminating health disparities, a big limitation of healthcare. With that being said, it is clear that technology in the future will continue to adapt and improvise to the well-being of the citizens of the United States. Thank you. Any questions?
Slide together. We'll start down here. Oh, wait, I did it the wrong way, sorry. Like this way. All right. You ready?
Yeah.
Okay. Isabel, give me one of the ways that you think that your thinking changed as a result of Braden's findings.
My thinking has changed with Braden's finding because I never really thought about virtual reality for making sedation doses less needed for patients. And the example that he gave us was the hand surgery man, and I never thought that that could happen.
All right, next up. Braden, if you have another team member, what perspective or limitation could they have reached that would have made a useful contribution to your project?
We had another team member, another perspective that could have been useful to the project would have been cancer research. Cancer is a leading cause of death in the United States, and so providing ways patients can receive treatment and using technology, patients can receive better care.
All right. Lucas, how did the group decide to include Titus's perspective into your overall presentation?
It fit well with everyone because it was general treatment for things like vaccines. It could be general treatment for disabilities, and it just was a very general topic that was kind of an overview of everyone else's.
Okay, thank you. Excuse me, Titus, what's an example of a compelling argument from one of your peers' reports that you decided not to include in the presentation?
A compelling argument would be from Lucas's IRR, and it would be that there are some negative viewpoints on how technology impacts healthcare, and we decided to leave it out because we wanted to stay positive and to our solution.
All right. Last up, reflecting on your colleagues' work, which one had the greatest impact on your overall understanding of the problem?
I think Braden's perspective has the greatest impact on my overall understanding of the problem, because virtual reality plays into what I was talking about with assistive technology, and that can help people with disabilities in the healthcare.